Hello, this is William. I'm presenting a case for this patient who came in and was admitted to the hospital with, he had some, start by saying he's a 72 years old male and his name is Perika Juno. And he was admitted in the hospital. He could identify himself and his name and his home address and his address. So then the patient also said that they were admitted because of yellowness of the eye, the body looked pale, and abdominal pain and back pain, and they are fatigue all the time. They have fatigue all the time, and patient also noted weight loss and expresses less appetite. So complained also of nausea and vomiting. Then also noted that their stool was light and the urine was dark. Now, while talking to this patient, doing some background assessment, I looked into what the patient had before, even in the chart, the history, and the history, which I have right in front of me, state that the patient was first diagnosed currently the patient came in here because of some severe pain of about 8 on 10 as reported by the patient on the pain rating from 0 to 10 with 10 being the worst and 0 being like the least. So the patient pain was 8 on 10. Then the patient also he's diabetic for almost 10 years now. He's still diabetic to date, and he also has no allergy, and the patient also has had pancreatitis about 2 years ago. Then that's what the background. The patient has smoked 30 pack per year for over 30 years, and the patient drinks about 2 to 3 bottles of alcohol drink a day for till date, for the entire life to date. Now, when I look at this, I have to do some physical assessment, check the vitals of the patient. The vitals were a bit high, and I'm attributing that to pain. Then did some did some assessment on the abdomen, and I realized the right upper abdomen here had some tenderness, and the patient expressed pain when it was palpated. And upon auscultating the abdomen, got some abnormal sound, but it was kind of maybe just hypoactive, not too active. But upon palpating, it was really painful. Then from there, the patient also, we ordered some lab result. Lab result came up to show that the patient has hepatomegaly on the right upper quadrant, which ties to the diagnosis I made of right upper quadrant pain and tenderness. And with the other lab result, the ALT and the AST test, liver function, show some abnormality. And also, I would say for my assessment, I'll inform the physician that due to the fact that the patient is having some light stool and dark urine, that is usually attributed to the fact that the bile duct in the pancreas is blocked, so bile is accumulating, and it also attributes to the yellowness of the eye because of bile just accumulating in the body. And since bile forms a major portion of the darkness in our stool, once that is blocked, we have the patient presenting with the light stool and the urine get darker. So I would my assessment will tell the doctor that the physician that I think the patient should be having something around the pancreas or the right upper quadrant of the abdomen. And with jaundice and all the other signs of pain, then with lab result also revealing that there are some abnormalities in terms of bile of the yellowness, that is jaundice the patient has, accumulation of bilirubin, all those things. It's a sign that has to be taken seriously. I'll put that in my note. Then patient is still weak, my lethargic, very weak, then then after, let's say after this assessment, the patient was put on this medication, chemo of 5-hydroxyfluorouracil, and that's one of those treatment for pancreatic cancer. Let's assume that the patient was put on this medication, then the doctor placed an order for this cancer medication. Then I would start by checking my interventions, which would include making sure that if patient complain of any pain along the injection site, I'll apply some ice to the injection site. And the patient now also look at monitor ins and out. And since the patient complain of losing weight, we'll monitor the patient's weight daily. Would also make sure we're checking on the patient insulin level, and making sure his diabetes is under control. And we also check for the patient also complain of, we also give the patient because patient might also be lack of appetite. Patient might also be at risk of fluid deficit, so giving the patient enough fluid will be one thing would like to do. Initiate fluid with, depending on the lab that the patient presents with, and maybe electrolyte fluids would be better. And or maybe if the dehydration is really bad, then we might give the patient some normal saline, and it depends on what the doctor will prescribe. We'll initiate that one. We'll also check on other aspects like coping, and the doctor just stated that the patient has pancreatic cancer, and now the patient is at risk, and the doctor stated that his time to live is too short, and their family is so concerned now. And I'll just talk to their family that this is what the doctor said. I would ask if the patient has any advance directive, if what to do if they pass away, and then start preparing the patient for the grieving process. I'm gonna let them know that this is what is happening, and maybe they might want to know what causes pancreatic cancer. And my answer would be there are many causes, and usually it's hard to pinpoint where the thing is coming from. But what we would know is that it's a cancer that 95% is exocrine related, and just 5% is endocrine related. So, and it attacks the pancreas, the head of the pancreas. And usually the best option would be, maybe if that is deemed necessary, the best option would be surgery, taking that off. But most of the times the pancreatic cancer is really asymptomatic, and by the time the patient gets to the hospital, it's already too late. It's spread around, metastasized to other areas on the whole thing. The whole pancreas is affected, and that's why usually it takes people's life so quickly, because of the fact that it's usually diagnosed at the late stage. So for now, encourage the family with coping skills, telling them, we'll treat the patient with depression, talk to them if they need help about counseling, talking, and how to cope with this, and advise them not to avoid other people visiting who have infection or respiratory issue visiting their dad, and we'll just keep talking to if the patient would have to live for a little while, we might talk to the family about palliative care. They might take the patient to a center where they could continue treatment there rather than sitting in the hospital for long. And then we might look into other things. Might look into the pain. We use pain medication to treat the severe pain. We might use narcotics, maybe fentanyl, morphine to treat that one. Then the constant check is supposed to be done liver function tests. Then they might also use aspiration of pancreatic eyesight fluid by abdominal pancreatitis paracentesis. They might use that to further diagnose and monitor the patient going. Some more teaching would include, we'll talk about analgesic, we'll talk about give the patient antihistamine for the nausea and vomiting to prevent that. Would also give the patient some antacid. I think that is what we would have to do, just to monitor that patient, and because the patient would be at risk of fluid deficit, a risk of acute pain, then we would manage just to, I think, just keep monitoring the symptoms and providing care for that patient for those symptoms. Okay, thank you.